Mercado, and we're here with Planned Parenthood Texas folks today, and our friends from Emmett Shelley from the Houston area and from Tent. A little bit about Planned Parenthood Texas folks. We are the advocacy and political arm for Planned Parenthood in Texas. Planned Parenthood in Texas operates nearly 40 health centers and serves nearly 120,000 patients each year. We are very excited for this new opportunity we have in HD 148 to elect another champion for reproductive rights, just for our retiring, who was a longtime champion for Planned Parenthood and the chair of the Women's Health Caucus. This last session, we helped defeat 36 of 40 anti-choice bills, thanks to the Women's Health Caucus and thanks to the leadership of Representative Farrar. We're so excited to help elect another strong champion for reproductive rights. But reproductive rights is not the only issue that our patients care about. Planned Parenthood patients do not live single-issue lives and care about many issues that impact their day-to-day lives, their families, and their communities. And that's why we're proud to have our partner here today, Emmett Shelley, and I'll let them introduce themselves.
Hi everyone, I am the current Executive Director for the Transgender Education Network of Texas, better known as TENT, a lot easier to say too. My pronouns are he, him, his, and I am currently not in my official capacity as the ED as I moderate this, but I am here as a very happy and proud supporter of Planned Parenthood and all the amazing work that they do for the entire community, especially the trans community. Often, in many cases, Planned Parenthood, as they've opened up HRT and trans-affirming care, in many cases, for many transgender Texans, that is the only option where they can find competent care for their medical and health needs that treats them with dignity and respect and has a understanding and deep capacity of what those health needs are and how they are a little bit different than our cisgender counterparts and still very much the same.
Well, thank you so much for joining us today, and thank you for all the candidates that we'll have with us. This first section will have 5 candidates, and then we'll take a short break, and we'll be back with 4 more candidates. It's a big race that we have here going on in HD 148, and we're very thankful for the time of all of our candidates and participants today. First up is Alva Treviño. Can you introduce yourself, please?
Hi, good afternoon. It's great to be here with Planned Parenthood. It's a great organization. I'm happy to be here to support it, to continue supporting it. My name is Alva Treviño. I'm an attorney. I've been in public law for over two decades. I live in the Heights. I've been a longtime supporter of Planned Parenthood. Can I go into a little bit of my personal history with Planned Parenthood?
That's probably our first question.
Okay,
So that's probably a great segue. So in our first question, in what ways have you shown support and been involved with the fight to expand reproductive health care access? How have these issues personally impacted you, and how have these experiences shaped your perspective?
Well, I will tell you that I grew up in the Valley in McAllen, Texas. Back when I was in college, going to Pan American University at the time, Planned Parenthood was very instrumental in my success as an attorney and me being able to get an education. Planned Parenthood offered a lot of health care services to me and a lot of my friends. I will tell you that back then, there was not a lot of options for us. Planned Parenthood in McAllen, I went in there to get birth control pills. The nice lady behind the counter, when she told me what the price was, she sold me a whole year's supply of birth control pills, and they were each 25 cents at the time. And frankly, I thought it was going to be more because, as a 20-year-old, we really don't know what the cost of healthcare is. And I suspect that she would gladly have given me the whole year's supply for free. But I think without that kind of help from Planned Parenthood, it wouldn't be the success I am today. In many ways, things have gotten better since I was in school, but in many ways, it's gotten worse. The better is that now there's an app for that. Now you can order birth control online with Planned Parenthood's app. You can order a whole year's supply. But again, in many ways, it's gotten worse. Because of the Republican political machine, a lot of those health clinics are not being able to offer women healthcare services. I forgot to answer the second part of the question. Obviously, as all we are in this room, proud Democrats and proud supporters of a woman's right to choose. I've gone to a lot of Planned Parenthood events. I've given and donated in Mike Pence's name on his birthday. But also personally, I've had young women come to me to talk to me about their choices. And I'm mostly not there to counsel them, but just to listen to them. On a personal level, I've funded several young women so that they can avail themselves of those choices. I don't need to go into the details as to why or what their personal circumstances were. That's not my tale to tell. And I don't think anyone should even ask that question of a young woman unless she's willing to share it. And that's my personal story about Planned Parenthood.
1 in 5 women in the U.S. has visited a Planned Parenthood health center. Nearly 40 Planned Parenthood health centers across the state provide more than 120,000 Texans with essential healthcare needs each year. Yet here in Texas, we see some real extremist state leaders in our legislature that continue to attack this organization and cut off care for patients. If elected, how would you stand up to fight for Planned Parenthood patients in your community and across the state?
I will continue the good work that Representative Farrar championed in Austin. As we all know, the fight's never going to be over as long as there's a majority of Republicans in the state house. They passed SB 22 that did not allow local governments to partner with healthcare facilities that provide abortions. They passed another House bill, which is the live birth bill, that criminalizes physicians. That one right there criminalizes physicians for something that doesn't exist. It was a solution looking for a problem. They want doctors to be criminally prosecuted if they don't care for a live birth as a result of an abortion. That is not going to do anything to advance women's health care. What it does for the Republicans is it controls a narrative. It vilifies healthcare providers that provide services to women. And it's going to continue unless we get a majority in the Texas State House, including the governor's office.
Thank you so much, Alva, for your time today. We really appreciate it. Thank you.
Thanks for having me.
Great.
Keep up the good fight.
Thank you.